Good day, I'm Charles I. Baguio from BSNL 11, and today I am going to do an assessment of cardiovascular system. The cardiovascular system delivers oxygen, nutrients, and hormones and other important substances to our body. So now I am going to prepare the necessary equipment needed, like the pen light and the rectangular card, and of course the stethoscope. And prior to that, perform the hand hygiene to prevent the cross contamination and ensure the comfort of the client and privacy, and then the confidentiality of the record. Good day, ma'am. I am Charles Baguio. I am your student nurse for today. And may I ask your name,
Sophia,
age,
15,
and birthday?
June 10.
Okay. We are doing the cardiovascular system assessment today, ma'am. Are you aware of that?
Yes.
Okay. Okay, ma'am. So let's proceed. How are you feeling today?
Good.
Do you smoke?
No.
Do you feel chest pain?
No.
Okay, so what are your activities? Are you doing activities like exercise or sports or whatsoever?
Sports.
What sports do you do, ma'am?
Badminton.
Okay, thank you. So let's proceed to the assessment. The patient should stood at the right side of the client and position the client supine with the head of the bed elevated between 30 to 45 degrees, making sure that the head and torso are on the same plane. So instruct the client to turn the head slightly to the left and show the tongue tail light source on the neck, suprastellar notch, and area around the clavicles to observe the pulsations of shadows. Okay, ma'am. Can you see that ma'am? That side? Okay. To the opposite side, ma'am. Okay. So if the jugular distinction was notch, assess the jugular venous pressure by locating the highest visible point of the distinction of the internal jugular vein. Emphasize the distinction with tongue-tail lightening. As deemed necessary, raise the lower head of the bed to 30 to 45 and 60 and 90 degrees until the highest visible point of the distinction is in the jugular veins was observed. Okay, so for the next is measure the vertical distance on the centimeter above the sternal angle by extending a long rectangular object and the card horizontally from this point and the centimeter ruler vertically from the sternal angle, making the exact right angle. Okay, ma'am, can you please? Okay, ma'am. And then, okay. Okay, so it's done. And then we proceed to the assessment of the carotid arteries with the head of the bed slightly elevate 30 degrees position the client's head slightly toward the side being examined. Palpate the carotid artery continuously, avoiding the pressure and massaging the area. Okay, Mom. I'm going to palpate your carotid artery. Okay, this side. Okay. Okay, so turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his breath. And for a moment, auscultate the carotid artery, listening the breath. If the breath was heard, gently palpate the artery, determine the presence of striae. Okay, Mom. Look for this side. Okay, look for this side. Okay. Began with the general instruction of the chest wall in women. We keep to the right chest drape, gently lifted the breast and the left hand, or ask the women to do this for assistance to the right side of the client's head, and the bed is elevated in 30 degrees, and look for any abnormal pulsation. Shown a telltale light across the chest wall and over the cardiac apex to make these movements more visible. Okay. Okay. So simultaneously inspect the precardium for the pulsations while palpating the aortic area and pulmonic area and the tricuspid area and apical area. Palpate the hips and lift using the palm and hold the finger pads flat or the obliquely against the chest. Okay, Mom? I will palpate your chest. Okay. For the thrills, press the balls of the hand firmly on the chest to check the buzzing or the vibratory sensation caused by underlying turbulent flow. Okay. So, palpate impulses using the finger pads, flatly and obliquely, and the body surface from the aortic area, pulmonic area, and the tricuspid area. Okay. Palpate the apical folds using the palmar surface, 2 to 3 middle fingers, then the finer assessments palpated with 1 finger alone. And to confirm the characteristics of the apical impulses, nothing for location, diameter, and amplitude. We're using my 2 fingers. Okay, if unavailable to palpate the apical impulse with the patient supine, reposition the patients to roll into the left lateral side. Can you please roll to this side, ma'am? Okay. Okay, breathe properly, ma'am. Okay. Palpate again using the palmar surface, using the several fingers. Okay. If still unavailable to palpate, ask the patient to exhale fully and stop breathing a few seconds. And palpate again while a patient maintained to be partially facing left aside. Okay, ma'am, can you breathe like inhale and then stop? Okay. Inspect and palpate the epigastric area of the base of sternum and abdomen pulsations. Okay, ma'am, you can go back to your original position. Okay. For auscultation, assess the heart rate and rhythm placing by the diaphragm of the stethoscope at the apex and listening closely to the rate of rhythm and apical impulse. Count the heartbeat in a full minute. Okay, ma'am, I will going to auscultate you. Okay. Using the diaphragm of the stethoscope first, then the bell auscultate in the heart. In all 4 anatomic sites, aortic, pulmonic, and tricuspid area, the heart sounds, extra heart sounds, and murmur. Ask the client to breathe regularly while auscultating. Okay, ma'am, can you please breathe regularly for me? Okay, for the aortic for the aortic, okay, for the pulmonic, for the tricuspid, and the apical pulse. Okay. Repeat the preceding steps while the patient is in lateral position and at sitting position, leaning forward and briefly stop breathing after inhalation. Ma'am, can you please face at this side? Okay. I'm gonna auscultate you. Okay, breathe and then stop. And then for the sitting position, can you please sit, ma'am? Okay. Inhale, exhale, then stop. Okay. So we proceed now for the upper extremities. Assess each arm for size, symmetry, skin color, temperature from fingertips to shoulder, and note for the presence of the edema, lesions, changes in the skin, texture, and hair distribution. Okay, ma'am, let me check your skin, your colors of skin, and the symmetry of the hair. Okay, and your temperature also. Okay, for the Okay. Then inspect the veins of the peripheral veins and arms presence and or the appearance of the superficial veins. And then when the limbs are dependent and when the limbs are elevated. And then the next step is palpate the radial pulse, ulnar pulse, and brachial pulse individually and bilaterally. Okay, ma'am, let me check your radial pulse, your ulnar pulse, and your brachial pulse. Okay, thank you, ma'am. And then I'm gonna assist the capillary refill. Okay, ma'am, let me check again your capillary refill. Okay. And then I'm gonna performing an Allen test. Okay, ma'am, can you do this to your hand? And then I am going to say stop. So you go. Stop. Then do it again. Stop. Okay, let's try again. Stop. Okay. So, at the lower extremities, at supine position. Okay, ma'am, in the supine position, it's like this. Assess each leg for the size, symmetry, color, and temperature from groin to toes, and note the presence of lesion, changes in skin, texture, and hair distribution. Okay, so I'm gonna check the foot of the client. First, check the temperature. And then the skin color. Okay, and then the symmetry. Okay. Inspect the peripheral veins of the legs as presence and appearance of the superficial veins. The limbs are dependent and when the limbs are elevated. Okay. Palpate the femoral pulse and popliteal pulse in dorsalis pedis and the posterior tibialis individually and bilaterally. Okay, so I'm gonna assess first the femoral pulse. The dorsalis pedis. Okay, next is the popliteal pulse. And then the femoral pulse. Okay. So the next is assess the peripheral legs vein for the signs and ulceration, varicose, and thrombophlebitis. And expect the cause of ulcerations and varicose, redness and swelling over the vein sites. I'm gonna check your veins, mom, if there is an varicose veins. Okay. Palpate the calves for firmness and tension of the muscle, the presence of the edema over the dorsum of the foot, and the areas localized warm. Push the calves from the side to side and test the tenderness. Okay. Okay. Firmly dorsiflex is the client's foot while supporting the entire leg extension. Head and client stand or the walk. Okay. Assess for the capillary refill for both legs and repeat the preceding steps with the other leg. Okay, I am now assessing the capillary refill. Okay. Okay, for the summary and closing phase. Okay, for the summary and closing phase. Okay, ma'am, now we were done to our assessment of your cardiovascular system. And just to summarize everything that we covered upon auscultation, your neck, I have no swishing or blowing sound to hear, and the pulses are equally strong, which means normal and no trails. And your jugular venous presumes that it is at 6 centimeter of water with the pad elevated 30 degrees, which is good. For your chest wall of your heart, chest movement is symmetrical, no retractions, no trills, and the heart rate is normal. So for the assessment of lower and upper extremities, the arms are bilaterally symmetric with minimal vibration in size and in shape, and it is no edema. Skin is warm and capillary refill is good. The pulses are good from your brachial and ulnar pulses. So that's it So that's it. Overall, your cardiovascular system is doing very well. I'm suggesting to you that please do an exercise regularly, and please go to your doctor regularly for some checkups. And thank you for your cooperation. Okay, so that's all for my video for the assessing of cardiovascular system.